House comes to questions for oral answer. Question number 1, in the name of the Honourable Annette King.
Tēnā koe, Mr Speaker.
Tēnā koe.
My question's to the Minister of Health. In light of his admission yesterday that health funding has not kept up with all inflationary pressures under this government, how will the health budget absorb the increased cost of purchasing medicines that the Prime Minister said is likely to result from the Trans-Pacific Partnership Agreement?
The Honourable Dr Jonathan Coleman.
Kia ora, Mr Speaker.
Kia ora.
Mr Speaker, the member is being selective in her portrayal of health funding, which under this government has risen by $4.1 billion, actually an increase above inflation. The member is also getting ahead of herself on TPP. As the Prime Minister said yesterday, if there is any increase, it's likely to be small and the government will fund that. Over 7 years, National has increased and managed the health budget, whereas Labor blew the budget and left a deepening $150 million deficit.
Point of order.
Mr Speaker, mine was a straight question on notice, and the last part of that answer was unnecessary.
Order, no. That was not, no. And that particular answer was perfectly in line with standing order. Order! I do not expect the Honourable Annette King to interject when I'm on my feet, if she wishes to stay for the balance of question time. I'm giving a ruling as to the satisfactory nature of that answer. In my mind, it had a little bit of politics in it. This is a debating chamber. Point of order, Grant Robertson.
Mr Speaker, you have given previous rulings in this House about questions on notice. I'll have, Mr Speaker, this is a point of order.
I just want to deal with something else. I will give the very last warning to the Honourable Annette King. If she continues to interject through a point of order, whether her colleague is on his feet or I'm on my feet, I will be asking her to leave the chamber. I apologise to the member for interrupting.
Point of order, Mr
Grant
Speaker.
Robertson.
Mr Speaker, you have given rulings on previous occasions about primary questions on notice where members of when government ministers use their answers to that to take political flicks at the government. And you've previously said that was unacceptable. I can see why my colleague Annette King rose to take the point of order that she did, because that did contain that at the end of the answer. In fact, earlier in the answer it strayed close to it, but the last part most definitely was out of order.
I'm sorry to apologise to the member, but I don't recall giving such a reason. I judge every question on its time, and frequently a primary question will have a bit of political connotation in it. I then judge whether it's likely to create disorder. In this case, I don't think that answer was unacceptable, as I've already indicated. So in actual fact, what we have here is a case of the member relitigating a point I've already ruled on. Further supplementaries, the Honourable Annette King. Supplementary question, the Honourable Annette King.
If funding for the increased cost of pharmaceuticals arising from the TPP deal will not be, quote, by raiding the budget, end quote, as he claimed yesterday, how much has Pharmac, who has been providing technical advice to him, said that would be needed to cover the savings Pharmac normally achieves in Vote Health?
The Honourable Dr Jonathan Coleman.
Well, look, the whole point, Mr Speaker, is TPP hasn't been signed yet. We don't know what is in it, and that is a budgetary matter which would be dealt with at the next budget, should TPP be signed.
Supplementary question, Mr
Supplementary question, the Honourable Annette King.
In light of that answer, is he saying that he has had no advice or assumptions given on the impact of the TPP on Vote Health, even though we know Pharmac has been providing technical advice to the Ministry of Health, or is he being kept in the dark?
The Honourable Dr Jonathan Coleman, either of those two questions.
Refer to answer 2.
Supplementary question? Oh, supplementary question, Barbara Stewart.
Thank you, Mr Speaker. In light of what the Minister is saying now, how does he reconcile that with what his Prime Minister said 1 month ago, and I quote, "We won't sign anything that undercuts Pharmac in a way that would have a dramatic impact"?
The Honourable Dr Jonathan Coleman.
Well, there's no contradiction there at all, I'm afraid.
Speaker.
Point of order, the Honourable Annette King.
I seek leave to table a letter received today from Pharmac, received under OIA. Is that all you need, Mr Speaker?
Yeah, that's all I need. I'm putting the leave. Leave us to table a letter from Pharmac dated today. Is there any objection to that being tabled? There is none. It can be tabled. Supplementary question, the Honourable Annette King.
Is he aware Pharmac saved $1.4 billion this year alone on the purchase of pharmaceuticals for New Zealanders? And how will this sort of savings be affected if patents are increased for longer, as indicated by him in the House yesterday?
The Honourable Dr Jonathan Coleman.
Mr Speaker, I'm very glad that Mrs King has brought up Pharmac's performance, because it has been excellent. In the last year, they've funded 20 new pharmaceuticals, and 21 existing pharmaceuticals have been funded for new uses over the same period. And that is going to benefit 70,000 extra New Zealanders over this coming year. So yes, I am aware of their performance.
Supplementary question, the Honourable Annette King.
What advice has he received on the impact on cancer and heart patients if they are required to wait longer before they can access generic medicines because of extensions made under the TPP deal on high-cost patent medicines?
The Honourable Dr Jonathan Coleman.
Mr Speaker, Mrs King's making a massive assumption there. TPP has yet to be signed.
Point of order, the Honourable
Mr Speaker, I asked what advice
I'm going to
received.
invite the member to ask that question again.
What advice has he received on the impact on cancer and heart patients if they are required to wait years longer before they can access generic medicines because of extensions made under the TPP deal on high-cost patent medicines?
The Honourable Dr Jonathan
Mr Speaker,
Coleman.
there's absolutely nothing to indicate that that will happen.
Supplementary question, the Honourable Annette King.
If the TPP deal won't raid the health budget, but Pharmac are unable to make the savings necessary for DHBs, where will the Ministry of Health find $40 million over the next 4 years to fund home care for the disabled, given the Ministry has to also find $32 million of cuts in the same period?
The Honourable Dr Jonathan
Speaker,
Coleman.
The first point is there are no cuts to the health budget. We've actually increased it by $4 billion over the past 4 years. The second point is Mrs King has made it clear she's opposed to TPP, but she might want to think that actually if we do end up with TPP, we'll have a far stronger economy and be able to afford much more in terms of healthcare. So that's really what she wants to consider. What is in New Zealand's interest here? Settle down.
Order.
Point of order.
Point of order, the Honourable Annette
I seek
King.
leave to table an OIA from Treasury, a report dated the 22nd of April this year that shows funding for disability support coming out of the Pharmac drug savings.
I'll put the leave sought to table that particular OIA. Is there any objection? There is none. It can be tabled. Supplementary. Order. 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 Supplementary question, the Dr Russell Norman.
Thank you, Mr Speaker. Has he received advice as to the impact on the health budget of any potential TPP deal?
The Honourable Dr Jonathan Coleman.
Mr Speaker, officials can't provide advice when they don't know what's in the deal yet.
Point of order.
Order. I hope it's not that the question hasn't been addressed, but I'll listen.
It has not been addressed.
Order.
It has?
The question...
Have you or haven't you?
Order. The question was definitely addressed. Question number 2, Fletcher Tabuto.